We just found that out last night.
We couldn't believe it. Because I thought, oh, she likes vegetables now. That's all I eat.
That's okay. I like a lot of the things I eat.
We're here to talk about my story, which started about almost 4 years ago in the fall of 2011. I felt so weak that I didn't feel like I could get dressed for work in the morning. And my whole life I had been a very energetic, even hyperactive person. So for me that was just, I didn't know what was wrong. And I found a lump in my breast, in my right breast, which was quite large. And the next day I went to my doctor and she immediately sent me over for an ultrasound. And there was a very large mass in my breast. So the following Monday, there was a biopsy, which came back positive for cancer, breast cancer.
Okay, when I first got the call from Kat that she had cancer, I knew it was bad. And I knew it was a lot worse than she had thought. And I knew that she would probably die. And then I suggested that she go see Dr. Young because we'd been reading his books. And immediately we started to see a change, and it was very, very good. And over the years I've seen her improve daily, and she's so serious about the diet. And so it's been an amazing, amazing thing. Dr. Young, really appreciate, and it's really good to meet you.
So Catherine, your path, much like Alice in Wonderland, took you to a crossroads, and and I don't know why I'm saying this, but I don't know if you remember the story Alice in Wonderland. But when Alice came to the crossroads, a Cheshire cat appeared. And Alice says, well, which road should I take? And the Cheshire cat responded, well, if you don't know where you want to go, any path will do. And it seems like, meeting you, and that you were fairly convinced about what you wanted to do. And it wasn't, oh, I'm just going to do traditional treatments, or I'm just going to do chemotherapy. That you took the path of combining the best of both worlds, which is called integrated medicine. And we have Dr. Ben Johnson here, who's an integrated medical doctor, and has worked with many cancer patients, as well as I, but I'm not a medical doctor. I'm a naturopathic doctor, so my approach is always to side more towards naturopathy. But I'm always intrigued with success, as you have had, because what I think we're all about is to have, a result of you getting better, and this is what happens. So while you're making these decisions and you decided on an integrated approach, I understand that you did low dosage chemotherapy with the PH Miracle program, and I just wanted you to comment on that, and then I'm asking Dr. Ben if he could give his thoughts on integration and low dosage chemotherapy, because I believe that's what you were doing in conjunction with the lifestyle and diet.
Yes. I feel that the PH Miracle program is a wonderful program to support the body and health. And when one is doing, conventional medicine, which, some of those medications are very hard on the body, that the PH Miracle program really is a good healing program that helps to offset some of the side effects and some of the damage that's done to the body by those therapies. I do believe that chemotherapy can sometimes be effective in shrinking down cancer cells, but it does cause some harm to the body. So I feel that integrative approach for me really felt right, because it was very aggressive cancer. It was pretty far advanced. I didn't know how much time I had there wasn't a lot of wiggle room. Perhaps if I had just done a completely alternative approach, I would be better off. I don't really know that answer, but at the time it really felt, to me, it felt like to kind of be seeing how I was doing over time, making decisions as I went along, to be watching my body and my health like a hawk, and to defend that, with the doctors. I was able to talk my doctors into putting me on the lowest possible dose of chemotherapy, even lower than they give patients normally. And to be able to take breaks from the chemo often, and to take me off all of the side medicines, all the extra medicines. Because I felt that it would be easier for my body to heal from some of the toxicities involved. And I do believe that the integration of all of these things, and not just the diet, but all the other things, the other parts of the pH Miracle program, the exercise, the really good exercise, the alkaline water, and also bringing in some intermittent fasting, that whole ball of wax for me, and doing belief system and emotional work. All of that together, I feel is why I'm here and healthy today. So I really appreciate all of the help I've gotten from all the different healers, and so that's just what I chose to do. I think everyone decides to do what they feel is right inside of themselves and follow their inner path, and that was where my intuition was taking me.
So you really didn't have conventional high-dose chemo. You had low-dose chemo, and even lower doses than what the doctors, they just agreed to humor you.
Yeah.
There is a process called an insulin potentiated therapy with low-dose chemo, which is the way all chemo should be given, because cancer cells have 1,000 times more insulin receptors than a normal cell, because they're dependent upon sugar. So when sugar arrives, the insulin receptors open up the cancer cells so that it can get all of the sugar. And so the process of insulin potentiation therapy, you give insulin IV, it lowers the blood sugar level. Well, the insulin sensitizes the cancer cells, and then the low blood glucose closes up all the normal cells. So then you give a tiny dose of chemo, low dose, and it all goes into the cancer cells where it belongs. Doesn't damage the liver, doesn't damage your white blood cells, doesn't damage the heart. So it is a way that all chemo should be given. And you got low dose, and that worked for you.
Yeah, and I felt like the fasting too.
And yes, absolutely.
Because I got my blood sugar down, my blood sugar was getting down to like 60 on the day that I went in for chemo, or the day before chemo, my blood sugar was down to 60. And then it was probably lower than that, by the time I went in for chemo, because it was the next day. So I got my blood sugar really low.
It all worked together, the alkaline water, the pH Miracle diet, the low-dose chemo, the fasting. You did it right. Congratulations.
Thank you. And the fasting, to reiterate, is just water, nothing in there, just distilled water with pH Miracle drops. That's what I fast on, because any kind of food or anything, the cancer can feed on that, and then the cancer won't be as sensitive to the chemotherapy.
We see that if someone who has great motivation, goal, family, friend support, doctor support, doing much, much better. Can you comment on that?
Well, I'm very lucky, and I do have very good support system. I have my mom, Luana Lynch here, and my sister, Cindy Lynch. My husband is very supportive. Dr. Young has been a great friend, actually, these last few years, and has always supported my decisions. I really like my oncologist. He's a very sweet man. He's very open-minded. He's not pushy at all. He really works with me. I've been really lucky, and actually I had to fire 2 oncologists to get to him, so it takes a while to get the right team. But one thing I think that is important is to build a support team, for anyone, especially with someone with a diagnosis that's kind of scary. I go to a support group where there's a bunch of other people with metastatic breast cancer, and we all support one another, and all of them are doing really well. I think part of it is because we all support one another.
And your cancer group, they're starting to change their diet based on your diet of Dr. Young's.
They are. They're starting to order the supplements and from Dr. Young now, because I'm sending them to the website, and it wasn't an overnight thing. At first, the leader of the group was very much against diet, didn't feel that diet had anything to do with with cancer prognosis, but I didn't say anything because I could tell that the group was very against changing diets. I just decided I brought my own lunch. So I usually bring gazpacho because that's something that I could put in a container and bring with me, or a salad or a soup. And they would ask me, what am I eating? And then they started asking for recipes. So I started sending them recipes. I typed up a 20-page booklet of some of my own recipes. I sort of based off of the pH Miracle, same ingredients, but I like to make up my own. And one of the patients, she was so sick with the chemo, her colon would shut down. Every time she did chemo, she would end up in the hospital. So I said, well, just try this pureed diet. I mean, give your colon a break. Why don't you just try doing this for a few days before you go in for chemo, and do it for a few days after chemo, and give your colon a break and see what happens. And she was able to continue the chemo because her colon, it was much better. So that kind of sold her, and progressively she's been getting more and more. In fact, I just got a text message from her today because she wants to order some of the clay for her nausea, which works really well. The Montemarte clay works very well for nausea with chemo, much better than the over-the-counter medicines, which weren't working for her, or the prescription medicines. So over time, they've been getting on board little by little. And the last meeting, I was pretty impressed when they were all upset about the lunch and how unhealthy it was, and that none of them wanted to eat that. And they were all writing a letter to the hospital saying that the food was so unhealthy. Why are they serving this food to cancer patients at a support group meeting? So that was, to me, I felt like, wow, this group has come such a long ways, where they were all fighting over the cookies, and now,
now they're fighting over cucumbers.
Yeah, they were fighting over the cookies, and now they're upset that the hospital is serving that food. So
where are you today? Yeah, I mean, this has been a 4-year journey. I mean, it is a miracle that you're here and that you're in remission, but I mean, you overcame, if I'm correct, breast cancer, lung cancer, liver cancer, lymphatic cancer, bone cancer, and everything associated with all that. I mean, that's pretty amazing when you've got tumor markers in most of those areas. You had tumors in the lymph nodes, in the lungs. You had one in the liver. Am I stating this correctly?
That's correct. Yes, and so yes, it's been a long journey. And at this point, they're saying that I'm in remission. They're saying it. They kind of, basically, the way that they say it is they'll say no evidence of disease, or they'll say suspected cancer. They won't really say that it's cured. But what is cured? I mean, we go our whole lives, and then one day we die. What does cured mean? I think it's just a process of every day staying healthy, and I'm really happy to be here, and I feel grateful for my life, and I know that I'm going to live a long time longer. I don't know how long that's going to be. I don't know if the cancer is going to come back or not, but a lot of the fear is gone now, and because I know how to take care of myself, and I feel healthy, and I feel like I'm going to be around for many more years. And actually, my doctors agree with me, which is really nice. For the first time in 4 years, my traditional doctors are now saying that, yes, they could see me around in many more years from now. So it's a good feeling. So I'm very grateful to Dr. Young and to my family and everyone. Thank you.